think if you look at the data, being over the age of 75, being over the age of 85, those communities are far more likely to lose their life and get hospitalized as a result of COVID. And it's not like 5% or 10%, it's like multiples. And we want to make sure that we make it as easy as we possibly can for folks who fall into that over 75 category to get vaccinated and to get vaccinated early in this process. Think about how much things changed for the over 75 crowd when supermarkets started making it possible for them to have a particular day or a particular morning to go to the supermarket. Many of those institutions have kept that over 75 day in place ever since. And the reason they did it was because they realized for a lot of people it was a game changer with respect to their ability and their willingness to go. And as we were talking to the folks from Curative earlier, there are folks in this group who are showing up 30 minutes, 60 minutes, 90 minutes before their appointment because concerns that, the place is going to run out of vaccine or my appointment might not happen or it might get canceled. I mean, this is not a community, generally speaking, that is necessarily across the board going to leap into this without giving them a little bit of time and some support to get there. Now, the good news is, literally, probably more than 100,000 at this point of people over the age of 75. We'll know a lot more about this tomorrow when we get sort of updated on the data load. But a ton of people over the age of 75 have already done this at mass vac sites. We want to make sure before we go to a next category that we've gotten everybody we can possibly get who falls into that classification, who's not getting vaccinated through a skilled nursing facility program or an assisted living facility program or a senior housing program or a 202 program. We want to make sure all the folks who can possibly make it do, so that when we go to the next group, we can be pretty sure and pretty comfortable that we've done all we could straight out of the gate for those folks over the age of 75. We were talking about this, and this is one of the things that some of the folks in the senior community said to us was, if you really want to move up the numbers on this, if you want to get more of them to come, give them the ability to bring somebody who's a trusted caregiver. Could be a companion is probably a better word, and make it possible for that person. Because one of the things we heard from some of the senior groups was that people don't want to put the burden, if you want to call it that, on a family member, companion, friend, whatever it might be, to take them to a mass vac site to get vaccinated. One way to make it a little less of a burden, or to feel like they're being a burden when they ask somebody to help them do it, is to be able to say that that person can get vaccinated when they come with them. Many 72, 73, and 74-year-olds have been the companion who have shown up at these sites with the people who are 75 or older, and have asked exactly that question. And it's a good one. I think the opportunity here is to actually get more of the 75-year-old community to go through this process. Many of them will still come the way they've been coming. And, anybody who's been with us on any of the visits we've done to any of these sites knows that the vast majority of the people who are showing up at these sites are in fact the 75-year-old community, plus, 75 plus. But I think if we can encourage more of them to come and to get their shots in the long run, even in the short run, that's a good thing both from a health and safety point of view and from a public safety point of view. I think just the opposite. I think what's more likely to happen is you'll get a lot more of the 75-year-old community to agree to come and get vaccinated because they'll be willing to ask somebody to help them come with them, and that will make it easier to move into the next round.
Governor, Captain Smith from the National Guard has announced today that he's got a team here in Danvers. There'll be a team in Springfield. He told us repeatedly, we don't need them now. We'll let you know when you call the Guard, they come. Well, now they're coming. Are they coming on their own?
Yeah, I never, for the record, I have never, ever, since I became governor, said we don't need the National Guard. I would say over the course of my time in office, time and time again, we've relied on the National Guard to do all kinds of things. And the biggest thing they've been helping us with over the course of the past 5 or 6 months has been SNFs, long-term care facilities, where they have been a critical asset in ensuring that we do everything we possibly can to keep folks who are in what most people would agree is one of the most challenging environments in congregate care, which is long-term care for people with disabilities who are elderly and managed in skilled nursing facilities. I also said that when we got to the point where it would make sense to bring them in, we would. And they are currently doing what I would describe as important work around logistics and operations at a number of these locations. And because they come when they're called, to get back to Jonathan's point about that, they do. I don't need to give them a heck of a lot of lead time to ask them to get involved in stuff.
Are you saying you do need them at this point? Because it seems like there's a lot of staff here. Is it sort of symbolic, or why just Danvers and Springfield and not the letter kind of like on the road?
Like I said, we use them when we think they can be extremely helpful to us. One of the things they have at Fenway that we don't have at other sites is we have the people who manage a lot of the logistics associated with the Boston Marathon who are helping with the logistics there. And the folks at Gillette, I mean, they're they're among the very best crowd management and sort of logistical operators we have here in the Commonwealth because of the nature of what goes on there, not just the games, but also the concerts and all the other events. We decided that we did. Why not?
You've been pushing back for a week and a half on it.
I know that, and for a week and a half we didn't do it, and now we are. I don't understand what the difference is. I mean, we said we would use them, and we thought it was appropriate in some of these sites to bring them in for logistical support purposes. I don't understand why that's such a hard concept. It's kind of been the way we've been working. We've been working with them on an as-needed basis, not just through this crisis, but through many others as well for a long time. The date's going to come when we feel like we've gotten to the point where we've reached a big enough portion of the 75-year-old population to move on. Pardon me? I'll know much better. I'll give you a much better answer on that one by Friday. I mean, some of this data rolls every week along with the vaccination distribution we get from the feds.
Why only the accompanying program for masks? Is it because they just have that average of
They're really high performers.
We're getting that. Well, why is it that the Marshfield local health department getting this access?
If you look at the performance across the country, the states that have done the best job in getting shots into people's arms are the states that have big sites. They are by far the most productive operating model anywhere in the country. And at this point, they represent a pretty significant portion of the shots that we're getting into arms here in Massachusetts, which is why we're adding 2 more, one in Metro West and another one in the South Coast. I think for us, with the limited amount of doses we have, and the incredible pressure to get as many doses into people's arms as we possibly can, as quickly as possible, following what has proven to be most successful in most other places in the country, is to use very big sites to move big numbers, and then to build collaboratives in places where you don't have big population centers, which is why we have a collaborative in Berkshire County, a collaborative in Worcester County, a collaborative in Barnstable County, and a collaborative in Franklin County. That is, in many respects, the fastest and best way to move administration forward with a limited supply of vaccine.
So will they be getting more doses? They're ordering 1,000, they say they're getting 0. I'm just trying to.
We had 451,000 asks for first doses, and we had 103,000 first doses to distribute. Look, I would love to be able to distribute more doses, right? I can't do that until the federal government makes a decision with respect to J&J, and until things change with respect to the volume that's associated with the Moderna and Pfizer distribution.
Governor, do you have any plans to add asthma back in as one of the comorbidities that would allow people in that phase to get vaccination? We've been hearing a lot of concern from legislators, saying that this could have some implications on equity as well forward.
Secretary and I have talked about this, and we're talking to the advisory group as well about this. And believe me, this is a very top-of-mind issue for all the reasons you just raised. It's not consistent with the CDC guidance, but it's something we're definitely talking about. Soon. Since I don't know the answer, I don't know the total answer to the phase 2 number for a couple of days, it's hard to answer the phase 1 number, because remember, all those people who are eligible in phase 1 can continue to get vaccinated all the way through the process. The nursing home number is completely, it's calculated, remember, that's a federal program, and it's run by, it's managed by CVS and Walgreens, but it's basically run by the feds, and it's separate from the stuff we're doing. No. So the best way I can describe it is to say that it's kind of an organized, it's like a route, right? You're going to hit this one, and this one today, and then tomorrow this one, and this one, and you do the route. Then you go back and you do the route again, and then you go back and do the route again. They're in the midst of the third trip. Now, there may be, probably will be, on the third trip through, residents who didn't get vaccinated in the first 3 trips who will didn't get vaccinated in the first 2 trips, who on the third trip through will say, you know what, a bunch of my friends here did get vaccinated. They got both doses. They seem to be doing okay. So now I think I want to get vaccinated. And the same thing is happening with staff. So my guess is there will be a 4th swing through. I mean, at this point in time, I think 88% of the residents of the SNFs and about 65% of the staff, 63% of the staff have gotten vaccinated. But, we can't, this is one of the challenges with the 2-dose, right? You can't stop running the program if people show up on the 2nd or 3rd visit to get a first vaccine because they decided after they saw their coworkers or fellow residents get vaccinated that now they want to get vaccinated. And people are still coming in who are part of phase 1. I mean, there are first responders who are still getting vaccinated in some of these mass vac sites. There are folks who are healthcare workers who are still getting vaccinated at some of these sites.
Governor, can I ask you about waste? I know that it's probably impossible to do 100% given the scope of what you're trying to pull off here.
Well, obviously, the storage requirements for both Pfizer and Moderna make the process not just of storing them, but also using them more complicated than it would be for a vaccine that didn't require a deep freeze followed by a thaw, followed by a certain period of time where you have to use it and you can't refreeze it, right? The J&J vaccine, one of the reasons so many of us are interested in it is because it doesn't have that kind of really high bar with respect to how you manage it to be able to use it. Any vaccine that gets lost is a missed opportunity to vaccinate somebody, which, especially when you're talking about the populations we're talking about here, is a tremendous loss. And I think what I would say about that is most of the sites are working on guidance they got from us, so are the providers, all of the folks who do this, about how to manage, especially the latter part of your day with respect to your schedule, and to have sort of callbacks or quick call people that you believe you can get vaccinated who are eligible if some people don't show up. And I think at this point in time, that's worked reasonably well. The other issue, frankly, just to get really narrow about it, is there's 5 or 6 shots in a vial, and so to be really accurate, you got to make sure you're going to be able to use all 6 shots in each vial. And one of the things that does happen, some of it is for a bunch of reasons. It's not that it gets wasted, it isn't usable because of something that happened with respect to either the thawing process or the process of mixing it up. But I think at this point the loss rate is 0.13%. Now, that still represents roughly 1,300 vaccines, which we would have much rather see go in somebody's arms. And if anybody performs really poorly on this, we're just going to stop giving them vaccine.
Where's the most waste happening? It sounds like it's not happening with the masks, but is it happening
The numbers are small enough that I wouldn't draw broad conclusions about one or the other.
but nobody's been in the state masks. Last week.
Yeah, I mean, they're pretty close, pretty much close to 100% of what they get, they administer quickly.
So can I ask about secondary data yesterday? Any comments come to light regarding the competing interests on expanding wind energy as well as the fishing industry, and where do you hear, because something about it is you're trying to marginalize the fishing community. And I just want to know, is this representing the will of the administration, or is it perhaps time for him to go as a group of lawmakers suggested to you in a letter to Oregon?
So I don't know what the issue you're raising with respect. I mean, there's been an ongoing and extremely difficult, for a lot of reasons, debate and discussion between the wind industry and the fishing community for a long time. And one of the reasons I took a trip to London back before the pandemic was literally to meet with the fishing community in England, which had been dealing with offshore wind for years, to get a sense from them about process and procedure, because they seem to be both doing quite well. I mean, England has the UK has a ton of offshore wind, and they also have a very vibrant fishing community. And it was a very helpful trip in terms of how to think about these issues going forward. But there are definitely challenges just by virtue of the issues associated with change that are tied up in any offshore wind activity, especially a new one, which is what we're talking about here. And we have been and will continue to be big supporters of the fishing community here in the Commonwealth and beyond down the coast, because some of the folks in the Commonwealth actually do a lot of their fishing in other people's waters. And at the same time, come up with strategies that'll make it possible for people to site a clean and an important element of this country's energy future, which is offshore wind. I already told you that I thought the comments that were on that video last week did not speak for the administration in terms of tone, substance, style, or anything else. And that continues to be my position. He does not speak for me. I happen to think in all of these issues, the goal here is to balance the various interests that are involved. The issue with respect to offshore wind and fishing, you have to figure out some way to create balance there. The issue associated with all of these issues requires figuring out some way of balancing interests. And when I say no one speaks for me, if they say, you know, this one is going to be the loser and this one is going to be the winner. That is not the way. Look, in 5 years, 6 years, this administration, time and time again, has worked extremely hard to find common ground and balance when we make decisions among competing interests. And I get the fact that there are always going to be many competing interests when you get into any of these issues. But that's the way, you know, that's the way we should make policy. And that means in some respects, we'll make decisions like we believe the fastest way and the most appropriate way to deal with some of the issues around climate is to pursue a strategy with respect to buses and automobiles that's more aggressive than the strategy that might be associated with doing something in some other mechanism. But that's our sort of way of framing what we think of as the biggest benefit for the least cost. And I don't think you can go through these conversations. There is no such thing when you're having these kinds of discussions that doesn't involve competing interests. And it's the job of the folks in government to figure out how to manage that. It's the first I've heard of it. So I'm not, I mean, are they over the age of 75 or not?
Well, presumably this is for people who are not eligible, they would be expedited. They're talking about grandparents who are raising grandchildren with them and are at risk of being exposed. And there was a group of lawmakers sent a letter to you last week asking for.
I haven't seen it. We'll certainly look at it. One of the other things I've learned from my conversations with governors in other states that are high performers is the more complicated you make the process, the harder it is to get shots on arms. And that's one of the reasons we decided to make a clear distinction around 75-year-olds followed by 65-year-olds with people with two comorbidities, pretty clearly defined. But I haven't seen the letter, so we'll take a look at it and make sure we get back to them. Thank you. I'm not going to put a number on it. And the main reason I'm not going to put a number on it is I don't want to get it wrong. And the biggest driver in this is going to be how quickly the 75-plus community can get to the point where we've vaccinated enough of them to be comfortable that if we open this up to another very big group that will be very anxious to get the shot, that if you're 75 or older, you'll still have the ability to maybe get vaccinated. I'm going back to where I started. The data on the over 75 population, life or death, is so much different than the data for everybody else. Everybody else. I mean, the reason we started with, long-term care facilities that group in particular is off the charts relative to everybody else. The over 75 people are the next group that is literally most at risk here, by far. Now, the 65 and over people are more at risk than people under the age of 65. But honestly, we got to get as far through the 75s as we can, because they are, in many respects, far more vulnerable to COVID than anybody else. I'd prefer they not be, obviously, because this is a program for people in Massachusetts. But I don't see how we could deny them. So, you know, we spent a long time on the phone, the governors did, with the federal government talking about, like, kind of the question Sharman was asking, like, how far out, you know, we're all building capacity. We're building capacity with an assumption that at some point we're going to want to be doing 1 million of these a month, right? When is that? Like, when do we need to have that level of capacity? And they gave me the same answer I gave you, which is we'll get back to you. But what I would say in answer to your question is the amount of capacity we're going to have is going to be very much a function of the amount of vaccine we can project we're going to be receiving from the feds. And, you know, my hope is that we get to the point, and I've said this before, that we're doing 1 million vaccines a month because we have the volume coming and the capacity to do that. But for that to happen, the feds would have to start giving us 250,000 new doses, first doses a month, not 103.